I'm Dr. Dave Junkin, orthopedic sports medicine specialist with Seaview Orthopaedics. I did my training at Temple University, both medical school and residency. After completing my residency in general orthopedics, I went to the University of Kentucky for a one-year sports medicine fellowship where I was able to care for Division I as well as Division II athletes. After that, I went and joined a practice in the Philadelphia area. And from there went on to Central Pennsylvania, where I was able to be head of the sports medicine department. Since I've left Central Pennsylvania, coming to New Jersey, and I've been with Seaview now for just over a year. My specialty is knee and shoulder surgery, focusing on not only the basic arthroscopy, but up through joint preservation and even joint reconstruction, meaning total shoulder and total knee arthroplasty. My philosophy is to help to maintain the joint as best as possible, and most importantly allow the patient to direct care as to whether we try the aggressive salvage procedures such as repairing cartilage all the way up to reconstructing the joint or replacing the joint. I also perform rotator cuff repairs as well as ligament repairs such as anterior cruciate ligament reconstructions of the knee. Well, from an early age, my father would take me along with him when he would do hospital rounds. So I got to see, early on what it was like to be a doctor and just that patient-physician interaction, which was just very special. I could see in my father's eyes the joy that he had in caring for individuals. And then as I got older, when I got into high school playing football myself, I sustained a significant knee injury. Unfortunately, in my first varsity football game, I was lucky and I didn't miss much time, but my father was actually present there on the field, was able to care for me directly. So from that perspective, I was the patient for the first time, and followed his advice, and fortunately was able to get back on the field in a matter of just a few weeks. I only missed one game as a result. I did go to medical school with an open mind, but once I was more exposed to orthopedics, I knew that was the right fit for me. After completing my fellowship, I practiced for a brief period of time in the Philadelphia area, and then went on to Central Pennsylvania, where I was head of the sports medicine department at a small hospital out in the rural areas. Then had a family change and decided to come back east, closer to both my family. If you are experiencing knee pain or shoulder pain that has not been responsive to your home treatments, such as over-the-counter medications, rest, or just applying ice, it's time to be evaluated by an orthopedic surgeon. Many are quite hesitant to come see a surgeon out of concern that we're going to suggest surgery. Non-operative treatment is very effective, and in most cases, that is what majority of patients need. It is our philosophy and my philosophy to exhaust conservative treatment first and foremost. There's not anything we can't make worse with surgery, and that's an adage that I live by. When surgery is necessary, surgery will be discussed and recommended. It's very rare that surgical intervention is necessary. In fact, only about 1 in 10 patients that I see in the office on a day-to-day basis need surgical intervention. And usually these are individuals that have already had multiple attempts at conservative treatment, and surgery is the option. Now, however, there are acute injuries that surgery is the only answer, but that is more an exception to the rule. Majority of the time when I'm evaluating a patient with knee pain or shoulder pain, elbow pain, it has been an ongoing issue and getting worse, and we just need to do a few adjustments, whether it is lifestyle, suggesting physical therapy, adjusting some medications, or even more therapeutics such as injections, or just the general discussion of what can I do to make things better. There are numerous roles that we can be as physicians and help guiding you to the outcome that you want and to get rid of your pain. When your pain just doesn't seem to be getting better with what you're throwing at it, it's time to be evaluated by an orthopedic surgeon. Feel free to call my office or visit our website to book an appointment at your earliest convenience.